We were one of the first units in the hospital to sort of adopt, in a patient family-centered way, rounds at the bedside with the patient, and it's created great trust for the patients and the family members, as well as been great value for the interdisciplinary team, including the cardiac surgeon, cardiac anesthetist, any of our residents or fellows that are working in the unit, clinical nurse leader, bedside RN, respiratory therapist, pharmacist, and then other allied health professionals or consult team members, whether it's heart failure or electrophysiology, will attend those rounds with the patient at the bedside and include the patient in the round so that they can contribute and also have the opportunity to ask questions and understand the plan of care.
Well, Providence Healthcare is unique in that we treat the most complex, cardiac surgical patients in the province. We have kind of the quaternary programs in heart failure. We have heart transplantation. We have ventricular assist device program. We have lead extraction for infected pacemakers and defibrillators. I've
worked with this team in my role as operations leader since 2008. And I see the exceptional care that this team provides day in and day out, particularly with the extraordinary cases that we manage. And this team jumps in and remembers that there's a patient at the end of all the technology, and not only provides clinical expertise, but also that compassionate care that is so important, particularly when someone is in such a critical state.
Cardiac surgery really is a team sport. You may have a cardiac surgeon that's kind of the conductor leading the team, but it's very much dependent on everybody that's in the room. There are about 8 people in the operating room: the anesthetist, the perfusionist running the heart-lung machine, the nurses that are helping you at the table and circulating in the room. And essential to achieving a good outcome is kind of having a warm, communicative environment in the operating room. The whole team comes out with the patient and gives quite a detailed report to the nurses and hands over the patient to the team here, and they pick up the ball and carry it.
Primarily, we give the anesthetic for the actual surgery itself. The other role that we have is perioperative transesophageal echo. So echocardiography. So one of my colleagues performs the echocardiography study for the actual surgery itself. And then the third role would be here in the cardiac surgery ICU, where we're the medical leads for the unit here and coordinate and provide and manage care for the patients who've had cardiac surgery.
One other major focus of cardiac surgery and cardiac repair is the transcatheter valve program at St. Paul's, and that's a program that was pioneered by Dr. John Webb in the cardiology division, but which cardiac surgery has been very active in doing approaches when they can't get up through the arteries in the groin. We can go through the apex of the left ventricle, and St. Paul's has been a pioneer of a number of first-in-human procedures.
Over the last 2 years, as we have been exposed to more examples of what patient family-centered care is and how we can incorporate that into our practice, it's led to some initiatives that have brought the team closer to partnering with the patient and the family. As you know, we used to have sort of strict visiting hours throughout the hospital, and particularly in critical care. And we've changed our philosophy, and it meets with the mission and values of the organization, that we have open visitation. We don't have any timeout periods when patients or families can't be involved unless we're doing something specifically that's critical with the patient. We invite them to be involved at the bedside whenever they need to be.